Hello, I'm Kyung-Hoon Jong, a research assistant professor of Department of Neurology. Today's presentation was on behalf of Professor Wonju Kim's laboratory in Gangnam Severance, Neurology. Our technology today is a method of prevention or treatment of mTOR-related diseases through VEGFR-3 expression control. As our study motive for this technology, I will tell you about the content that VEGFR-3 expression on reactive astrocytes controls GLT1 expression, which is involved in glutamate clearance through mTOR signaling activation. First, let me introduce epilepsy. Epilepsy refers to a chronic intractability brain disease with this characteristic that seizures occur due to abnormal excitement in cerebrum, nerve, cell. And these seizures continue to occur and recur. This epilepsy is known to be caused by all age groups, and it is caused by a wide variety of complex causes. As shown in the figure, the prevalence of epilepsy has been reported in 7.6 people per 1,000 people worldwide, and as of 2016, the prevalence of idiopathic epilepsy by country can be seen as follows. As shown in the figure, it is shown that the prevalence is higher in low-income countries than in high-income countries. In Korea, the prevalence of epilepsy can also be seen in all age groups, especially in the U-shaped more prevalence of patients under the age of 10 and the elderly. And when we see the causes of epilepsy in all age groups, about half of them are found to be caused by causes such as stroke, brain tumor, and craniocerebral injury. But epilepsy is reported by unknown causes such as insufficient information or idiopathic potential. In other words, the exact cause of epilepsy has not yet been identified. The first treatment for epilepsy proceeds with the drug treatment, and from the 1850s to the present, anti-epilepsy drugs have been developed as first, second, and third generation drugs. As shown in the figure on the right, it shows a small mechanism of anti-EEG drugs, which first work as a small mechanism to control the seizures, and is used to control the nerve cell hyperactivity or hyperfusion due to their role in suppressing glutamate or inhibitory neurotransmitters. This picture is shown the market for these anti-EEG drugs, and as of 2019, it was reported that the central nervous system drugs totaled $86 billion. Although it is different by the analyst, it will be predicted that the central nervous system market will expand to about $101 billion as of next year in 2022 and $131 billion by 2025. In this market, the drug development market for anti-epilepsy covers 12% and is the fourth of all drugs in the central nervous system. Through this situation, the anti-empirical drug development market is expected to be bright and promising market. But there are limitations in these drugs, and as mentioned earlier, conventional anti-EEG drugs focus on controlling seizures, epilepsy prevention, or disease control. So to speak, the fundamental cause of disease is the lack of indications or treatments that can result in the beneficial effects on disease, progress, and pathophysiology control. In addition, it is the 1/3 of all patients of drug-resistant and drug-refractory patients whose seizures are not controlled despite using 2 or more of the existing drugs. As for the action criteria of drug refractivity, it can be thought that it will be shown by wide variety action criteria, as shown in the figure on the left. To overcome the limitations, it is seen as a need to target finding for new epilepsy treatments that can control the epilepsy seizures as well as understand the complex molecular biological phenomena that can lead to the recurrent epilepsy seizures, as shown in the figure on the right. As for the need mentioned previously, I will briefly present the changes in cell and cell structure during the epilepsy process. When brain damage that can cause the epilepsy attacks occurs, various cell and cell structural changes occur as shown in the figure on the left. Besides, various genes, working points, and molecular working points are accompanied. Finally, it results in the characteristics such as epilepsy and drug refractivity. Among these characteristics, what we paid attention to is a cell called astrocyte cells. These astrocyte cells are not only involved in maintaining cerebrovascular barriers, but also play an important role in maintaining intracellular homeostasis. But it has been reported several times in papers that the occurrence of epilepsy causes the dysfunction of these astrocyte cells, which is more involved in the occurrence of epilepsy. Here, we investigated what the candidate factors are involved in reactive astrocyte cells caused by epilepsy. Then, what we focused on in terms of candidate factors is the radical endothermic growth factor and the receptor or acceptor. As shown in the figure, there are a total of 7 families, including VEGF-A, B, C, D, and placental growth factor, and they are known as acceptors 1, 2, 3 to bind them. Among them, VEGF-3 is known as the regulator of vasculogenesis and lympangiogenesis, and is known to be involved in various intracellular action criteria. In the central nervous system, VEGFR-3 is known to be expressed in various cerebral regions, mainly in nerve cells, and is known in some astrocytes cells. But disease-related disease V has reported an expression increasing in activated astrocytes and activated micronized cells. As shown in the lower right, in the case of epilepsy, it was possible to observe the increase in VEGF-C and acceptor expression in cerebral tissue of epilepsy patients. And this increase in VEGFR-3 showed an increase in the expression in reactive astrocyte cells. These facts show that VEGF-C and VEGFR-3 expressions increase in hippocampus tissues of the pilocarpine-derived status epilepticus persistent animal model, and we can see that most of these increased VEGFR-3s appeared in reactive cells, as shown in the lower right. Accordingly, interest in the role of VEGFR-3 in reactive astrocytes caused by continual epilepsy, caused by SE, or how the molecular criteria for action is involved. In addition, at the same time as our previous study announced, it has been reported that the expression of VEGF-A, B, C, and its receptors in cerebral tissues in patients with drug-resistant epilepsy increased, and the expression of PI3K-AKT also changed. Accordingly, existing studies have suggested the possibility of being involved in the mechanism of epilepsy creation of a VEGF system. As you saw earlier, PI3K acts as a superior factor in mTOR, mammalian target of rapamycin, signaling to cause mTOR signaling activation. When mTOR signaling is activated, it is involved in protein synthesis as well as various intracellular action criteria such as cell cycle progression, proliferation, metabolism, differentiation. It is also known to be involved in the development of epilepsy. In addition, it was found that mTOR signal activity was remarkable in activated cells within the cerebral tissue of epilepsy patients. Through these existing facts and our previous studies, I will name epilepsy persistence 2SE afterwards. We investigated the interrelationship between VEGFR-3 and mTOR signaling and its role in this reactive astrocyte cell that appears after the occurrence of SE. The figure shows the outwardly positive checked to change in PS6, a signaling active marker for mTOR in hippocampal tissue after SE occurrence. The results show that the number of positive cells in PS6 was significantly increased on the 4th day of SE occurrence, and these results were increased at the same point in the relative protein level. In addition, the amount of VEGFR-3 protein was also increased as in our previous studies. And GFAP, a marker for astrocytes, was also increased. In this pattern increasing, VEGFR-3 and mTOR signaling marker PS6 became to colocalization within the reactive astrocytes cells after SE occurrence, confirming the possibility of mutual relationship. The following experiment was conducted to confirm the actual interrelationship. First, when rapamycin, a selective inhibitor, was administered to mTOR signaling, it was found that the expression of astrocytic VEGFR-3 was significantly reduced, and the relative protein level was also reduced. At this time, we checked the change in the mTOR signaling activity of astrocitic when administered with VEGFR-3 inhibitors. As you can see, the number of astrocytic PS6 positive cells decreased when VEGFR-3 inhibition was performed, and the relative protein level also decreased. Accordingly, it was confirmed that the expression of VEGFR-3 in reactive astrocytes cells after SC occurrence was correlated with mTOR signaling activity. We investigated what kinds of role, action criteria, and candidate factors are involved in these interrelationships. What we noted is glutamate transporter 1, which is involved in glutamate clearance, and as shown in the figure, GLT1 regulates the glutamate concentration of cells by reabsorbing and reuptake of glutamate present in astrocytes and secreting nerve cell synapses. But nerve cell damage or disease development causes GLT1 expression and dysfunction, resulting in cell damage by inducing the neuronal hyperexcitation and hypersynchronization. However, inducing or activating of this increase in GLT1 has been published in studies suggesting that the hypersynchronization of neurons between nerve cell synapses is suppressed, and consequently neuroprotection is improved, as shown in figure D on the right. Interestingly, since there were several research papers showing that the regulation of GLT1 expression is caused by mTOR signaling activity, we have investigated whether it is relevant in our study. First, it was confirmed that GLT1 of astrocytic was significantly reduced when the mTOR signal transfer activity was suppressed due to rapamycin administration, and the relative protein level was also reduced. When VEGFR-3 inhibition was performed, the number of expressive positive astrocytic GLT1 cells were also reduced, and it can be seen that it is also reduced at the relative protein level. In addition, when we further investigated whether VEGFR-3 expression is also involved in the activity of astrocytes, it can be seen that the activity of reactive astrocytes generated by SE is also reduced by inducing VEGFR-3 inhibition. Accordingly, it was found that the expression of VEGFR-3 shown in reactive astrocyte cells after SC occurrence regulates the expression of GLT1 via mTOR signaling activity. According to previous studies on GLT1, there are many research papers that have suggested the importance of GLT1 in epilepsy development, as glutamate resorption rate is blocked when GLT1 of astrocytes is lacking DNA. Accordingly, our study also confirmed that the expression of GLT1 decreased when VEGFR-3 was suppressed, and investigated how it would affect the polarity seizure activity caused by injection of pilocarpine. As you can see from our results, there was no change in the time of convulsive seizures caused by pilocarpine injection and the time of SE occurrence. It can be seen that the number of convulsive seizures has increased further. These results are expected to partially promote seizure activity by reducing the expression of GLT1 caused by inhibition of VEGFR-3. In summary, the expression of VEGFR-3 shown in reactive astrocytes cells after SC occurrence increases, and mTOR signaling activity is also promoted. There is an interaction between the two factors, and this interaction indicating that GLT1 expression is regulated. Through this, it has been suggested that VEGFR-3 activity in astrocytes will probably play an important role in hyperthermia after SE occurs. Through our research technology development, I expect to provide important ideas in the field of new drug development research for the prevention and treatment of mental disorders, including epilepsy, degenerative brain diseases such as Alzheimer's, Parkinson's, and depression. If the effectiveness of prevention or treatment is proven in various diseases caused by abnormal mTOR signaling functions such as cancer and tumor, we are expecting to expand gradually. With this, I'll end my presentation. Thank you for your attention.